In this video, we're going to be talking about crown and bridge. The process of prepping a patient and the procedure for crown and bridge is identical. So let's begin. Crown and bridge is a two-step process. Step one is crown prep or preparing the tooth to receive a crown. And step two, which is crown seat, which is seating a brand new crown on a prepared tooth. The process is simple. Obtain a signed consent from the patient. Also obtain a refusal or an acceptance for a crown upgrade and the shade selection. Take an initial impression of the tooth before any process has begun, and then the doctor will anesthetize the patient and start with the crown prep. Once the crown prep is complete, you will be asked to pack a cord around the patient's tooth and take a final impression. You are going to use this to deliver a temporary crown to the patient. It takes about 3 weeks at our office to receive the final crown and cement it. So schedule the next appointment for 3 weeks. Please remember, lab slips have to be signed by the dentist, and the due date for delivery should be 10 business days from the day of the impression. Input the case into Google Drive. There are some important things you need to remember when handling a patient with crowns. We want to make sure that our patients receive the best care and the best materials. It is your job as the clinical assistant to educate the patient on the options that they have. Most insurance companies will only cover a PFM or porcelain fused to metal crown. While these crowns are functional, there are better crowns available in the market today. At our offices, our doctors recommend the APC or the all porcelain crown made out of Bruxier material. Our doctors prefer these crowns because they are extremely durable, cosmetically superior, and come with a warranty. But because APC crowns are not covered by the insurance, they are available as an upgrade to any patient getting a PFM crown. However, the patient has to decide whether they want to accept the upgrade with a small upgrade fee or continue with the PFM crown. You must make sure that the patient agrees or refuses in writing to the upgrade, because once the crown is sent to the lab, we cannot change the type of crown. Also remember that a shade of the crown must be selected prior to sending it out to the lab, and the patient has to approve the shade before he or she leaves at the end of the appointment. A crown and bridge prep kit comes with multiple instruments, as you can see on this slide. Please make sure that your tray setup has all of this. Also remember to check the material delivery guns to make sure there is enough material when you take an impression. The second appointment of the patient will be for a crown seat. Again, at this stage, prior to the seating or bringing the patient in, check and make sure that the lab case has been delivered. Typically, there will be a note in the patient's chart that the lab has delivered the crown, and go to the lab area and collect the crown. See the patient get an informed consent signed. Take off the temporary crown. Sometimes the patient is sensitive when you do this, so you may have to place topical anesthetic as you take it off, or you may have to call the doctor and have the doctor numb the patient prior to you taking off the temporary crown. Try on the permanent crown and show the patient in the mirror how good the crown looks. Take a bite wing X-ray. Once everything looks good, the doctor will ask you to mix Reliax and then will cement the permanent crown in place. It is your responsibility to clean the excess cement after 5 minutes when the cement has partially set. This makes it easier for you to clean around the tooth. A new bite wing will be required and obtain the approval from the doctor for it. Here is a picture of what a crown seat kit looks like. Please make sure you have received the crown approval form prior to starting treatment.